There's some medications you have to know for your NCLEX, especially cardiovascular pharmacology. I'm going to take key facts, key medications that I think are very important that can be used in heart failure, especially cardiovascular pharmacology. Today we'll be talking about ACE inhibitors and ARB and marginal drugs. I'm going to give you the priority information and the key pathophysiology that you need to know. You know, most of these medications are very important. They can be used in heart failure, hypertension, and that thing. You have to understand the main fact why it's so useful and what is the main idea associated with that. First, yeah, I'll give you some of the information that you need to know in terms of these examples. Examples, these are common medication, which are called an ACE inhibitor, angiotensin converting enzyme inhibitor. The name give it away, right? A common type of medication is the last name that you can figure it out. They have common names, and then you will know that this is an ACE inhibitor, and the last name is per. First one is captopril. Everybody knows about that. But lisinopril it seems to be one of the common medication you will find in this group, or enalapril. The board will give you, and look for the last name. Sometimes they will give you ramipril. Don't worry about it. So far as they have the same last name, they do the same thing. What is the mechanism? How does this medication work? It's going to do specific things, and I will break down this pathophysiology. But in simple terms, there is something we call angiotensin 1, right? Angiotensin 1 is going to be converted into angiotensin 2. What this medication is going to do is going to block that procedure. So you block this. When this is blocked, basically there's no angiotensin 2. I'll use AA2. So there's no angiotensin 2. In the process, you don't have aldosterone, right? Aldosterone is responsible for you to retain sodium and get rid of your, well, potassium. Therefore, if you don't have aldosterone, you're going to have what? High potassium and low sodium. If there's low sodium, there's less water. And this is the why we use it for hypertension. And this is why we use for CHF. Very, very important. Another usage, just since we're here, let me give it to you. And the main reason why indication, I'll put it here, right here. Indication is used for hypertension, used for heart failure, you use it for patients who have heart problem. Don't forget that they have myocardia, so post MI. If you have heart attack, the injured vessels and then injured muscle of your heart need to remodel. So remodeling is provided by ACE inhibitor. It can also be very good in patient if they give you a patient who has diabetes and has hypertension, and they say choose one medication, you should give them ACE inhibitor. It's very good to prevent diabetic nephropathy. So it slows down the progression of kidney injury in diabetes. What is the pathophysiology? Let me give it to you. Just don't worry, it's not difficult. No nursing school, you see this before, but this is the key. There is something we call angiotensin, right? There's this medication or enzyme that we call it angiotensin. So you'll find it in the liver. So angiotensin, you find it in the liver. This has to be converted, okay? It has to be converted into angiotensin 1, so H1. And this, okay, in the liver, but you need something we call renin from the kidney. So this is produced from the kidney. So the kidney make renin and it go into the liver and break down angiotensin into angiotensin 1. These angiotensin 1 go into the lung and is converted into angiotensin 2 in the lung. This angiotensin 2 is a potent vasoconstrictor. It constricts your vessel, and this increases your blood pressure. This is why it's very, very important. The another thing that it does is what? It leads to aldosterone production. It causes aldosterone to be produced. What does aldosterone do? Aldosterone increases your sodium, it decreases your potassium, and increases water. This is the normal situation. And this is why this medication is very, very important. Additional information you need to know is here we have something we call Brady Cannon. This has to be converted into inactive form before it can do its job so that we can destroy it. And that is where these medications are special. What is the problem? ACE inhibitor, what does it do? It can get produced. It can here is an ACE, angiotensin converting enzyme inhibitor. What is it? Does it do? It come here and say you angiotensin 1, you're not going to go into angiotensin 2. So it block this. It also go here and say bradykinin, you cannot be converted into active form. I'm blocking you. In the process, you have high level of bradykinin. In the process, you don't have angiotensin 2. Therefore, there is no aldosterone. Therefore, your sodium go down. Therefore, your potassium goes up. Therefore, your water goes down. This is the mechanism of ACE inhibitor. And all the side effect is related to this mechanism. This is the pathophysiology. This is the RAS system, renin-angiotensin system, right? And this is how you can understand some of the function. So if we take side effect, right? We take the side effect, okay, and we say we want to figure out what are the main side effects of this medication. One, you can see, like, if he does his job, potassium K is up, elevated potassium. Sodium is low, and this is what is called hypotension, right? It decreases your blood pressure. The potassium goes up. It can cause arrhythmia, right? Because of the buildup of bradykinin, you're going to have cough. This cough is nagging. It's not too much a problem. You just have to do change it to ARB. It causes angioedema, and that is the flushing of the face, and this is the airway. And this is what I call B sharp moment. This is B sharp. Okay, this is B sharp. If you have to choose anything, this is their problem. The cause is angioedema. And so you have to educate the patient about neck, tongue swelling. And when you see that, call life-threatening as much as possible. It's also a teratogen. Therefore, you cannot use it in pregnancy. So avoid in pregnancy because it causes renal agenesis. It prevents the kidney from developing. So this is a key aspect of an ACE inhibitor. Your board love this. It's related to potassium. You teach the patient to avoid potassium-containing food, right? I strawberry, I fish, I anything that has too much potassium, right? Spinach, right? And tomatoes, all of them. I call them the fast, right? Anything avocado. They should avoid things that have what? Fast, right? Fish, avocado, strawberry, and spinach, and tomato. They should not take it because it has too much potassium. They should also avoid salt substitute. Okay, salt substitute is all potassium chloride. So they cannot take it. If they take it, it's a problem. The potassium is already high. This is everything you need to know about angiotensin converting enzyme inhibitor. And this is what your body is going to ask you. So watch for that and pay attention to that. It's key. His friend is ARB. What is the difference between ARB? ARB is angiotensin converting angiotensin 2 receptor blockers, right? They are angiotensin 2 receptor blockers. I already told you they do the same thing as ACEIs, but different way. We already know that we have our angiotensin here is going to convert to angiotensin 1. And this is going to be converted to AA2. And when we already have our Brady cannon here, is going to be converted to inactive form. Well, and then angiotensin 2 say, hey, let me make more aldosterone. What is the problem? Angiotensin 2 is very smart. He said, well, I don't want to cough, too much cough, and therefore I'm going to go and block the angiotensin 2 instead of, right? I'm going to block here where angiotensin 2 go and take care of and improve production of aldosterone. So it blocks here. Therefore, you have less aldosterone and you get the same side effect. You get the same sodium decrease. You cause your potassium high and then water low. This is so very, very important regarding this process. What is the key aspect? Because it does not cause it does not block angiotensin 1 enzymes. What it does is the bradykinin can be converted to the immature state, and therefore there is no cough associated with it. They may have angioedema, but the angioedema is a little bit not that, it's less common compared to angiotensin 1 or ACE inhibitor. Remember, the side effect is the same. Potassium is going to be high, therefore you tell them to avoid fast food, right? Food that have like fish, avocado, strawberries, spinach, and tomatoes, or banana, right? Avoid salt substitute because it contains so much potassium. And then the same kind of teaching you providing hypotension can occur, so be careful. Um, but you're not going to have cough. It's also teratogenic, so if you're pregnant, you cannot take it. This is ACE inhibitor. This is an ARB. I hope you understand. When you see them, you should not run away from them. Examples I call them Satan. So if you see any medication that has Satan as the last name, okay, so you have losartan. You don't have to memorize them. You see, that's the first one. You have valsartan. So I call them Satan, right? Or you can have Omi Satan. And the last one, Ir Satan. This is ARB. They don't have the prayer, but they have the Satan. Take care of you, take care of you, and be good. Good luck in your exams. All the best of luck. 2 medications you got to know. Key fact I've given you. The B sharp moment is potassium, and angioedema. Take care of yourself and bye.